First Lady testing positive for COVID-19. The White House now says Dr. Jill Biden is experiencing just mild symptoms at the family home in Delaware. Here to answer questions is Dr. Shira Doron, the Chief Infection Control Officer for Tufts Medicine Health System. Great to see you, Dr. Doron.
You too.
All right, Dr. Doron, we don't yet know whether President Biden was with his wife when she started feeling those symptoms, but so far officials say he's taken a number of tests. They've all been negative for the virus. He's now not with her. What's your advice should that change and the president starts to have symptoms?
Well, President Biden is vaccinated, and although he's higher risk by virtue of his age, he's likely to do just fine if he gets COVID like last time, but he's the president. And we have highly effective antiviral treatments with few side effects. So I would be surprised if he did not receive an antiviral again. Now, the data suggests that among the vaccinated, those who are older, like the president, have more underlying medical problems, are more likely to benefit from Paxlovid. Both Paxlovid and remdesivir are highly effective at preventing hospitalization when given within 5 days of symptom onset. So if the president tests positive and if he has any symptoms whatsoever, then he should be treated with Paxlovid, or if there's some reason he can't get that again, if it's on a new medication that interacts with Paxlovid, then he should receive intravenous remdesivir.
Okay, so we know you track COVID data very closely nationally. The number of infections, hospitalizations, they've been rising the past few weeks. Are you seeing the same trend here by us?
Yeah, we're seeing a gentle rise in both the wastewater levels and hospitalizations, and then the Northeast mirrors the national trend, although it's leveling off. And we've seen numbers in the Midwest and the South peak and come down quite a bit already. And the reasons for these trends are not entirely clear. There are some new subvariants of Omicron on the scene. I tend to think the main factor here is waning immunity. Every time we have a period with little viral activity like we had earlier in the summer, population immunity goes down, and then we see an upswing again, and it'll go up and down forever. But this week we got some really good news. There's a variant that's being watched closely because it has over 30 mutations. It's actually proving to be less transmissible and not very immune evasive. So I'm feeling pretty cautiously optimistic that at least that one won't be causing us any issues in the coming weeks.
We like to hear that. All right, Dr. Shira Doron with Tufts, thanks so much for your time. We appreciate it.
Thank you.